So let us get started. I welcome all of you for the Speed Learning app for daily classes, daily evening classes, live classes, interactive classes. And this is to overview of INI-CET PG 2021. It is going to happen in November, mid-November. So that we will do the important topics that could be an expected question in the INI-CET exam. So let us also have a review of what the question has been asked in this exam of NEET PG 2021 and what are the relevant topics that could be concentrated and could be asked in INI-CET. The question says patient faced an accident and had a straddle injury and patient presents with blood at the urethral meatus. What will be the next step? See, the minute you see a question like this, it is typically like a straddle injury. What are the key points? It is a straddle injury. Number 2, blood at the meatus. And following a road traffic accident, and one more triad will be acute retention of urine. Acute retention of urine. So this is a triad of bulbar urethral injury. This history is a typical history of bulbar urethral injury, man falling astride, man falling on a manhole and having a typical wedge injury, getting hit in the manhole, the rim of the manhole, and so that he has a severe perineal trauma, so that the bulbar urethra get ruptured, and once the bulbar urethra get ruptured and eventually a hematoma happens, bleeding happens, hematoma happens, and there is an acute retention of urine, and there could be few drops of blood in the external urethral meatus. Yes, and this is a typical case of a urethral injury and especially bulbar urethral injury. In exam, they can also ask you the most commonest site of urethral injury in exam. Again, the answer is bulbar urethral injury. Now, let us all try to understand the patient presenting with any form of urethral injury. Yes, the first and foremost step, it could be a bulbar urethral injury, membranous urethral injury, or it could be a penile urethral injury, whatever might be the injury. You should restrain yourself doing a urethral catheterization because it can create a false passage and it can cause more damage to the urethra if it is not pushed in properly. So that when a patient comes with an acute retention, the bladder will be full. The best thing to do is a SPC, suprapubic cystostomy. Because the bladder is full, under ultrasound guidance, you can put in a trocar and a cannula in the suprapubic space and to the distended bladder, especially puncture in the dome of the bladder. Then when you see the urine coming out, you push in a bolus and fix it. Yes, so it's a SPC, suprapubic cystostomy and catheterization. So urine will get drained. Once urine is get drained and the SPC will be maintained for 14 days. Once the SPC is maintained for 14 days, then after 14 days, you will do what is called descending cystourethrogram. What do you mean by descending cystourethrogram? That is, you will inject the contrast via the SPC catheter and then you will take an X-ray. So it will fill in the bladder and the urethra. It will go down. The contrast will trickle down into the urethra and you will be able to see what is the injury, what is the status of the injury. Now, once you do a descending cystourethrogram after 14 days, if you see the patency of the catheter and patency through the catheter, through the bladder and the urethra is also patent, yes, you will discharge this patient. Okay. Now, in descending cystourethrogram, if you see extravasation of urine, urinary extravasation, you will have to plan for surgery. So you will wait for urethroplasty. Okay, so you will plan for urethroplasty. So only the timing varies for urethroplasty. If it is going to be a penile urethral injury, you will do urethroplasty and urethral repair, realignment and soft tissue repair immediately. If it is going to be bulbar urethra, you will do it by 6 weeks. And if it is going to be membranous urethral injury, you will do it by 4 months. So this is an average waiting time depending on the site of urethral injury. So it's very, very clear. So this is a typical case of an urethral injury. This is how you will manage a case of a urethral injury. And I said this is the presentation of bulbar urethral injury. And membranous urethral injury is always associated with pelvic fracture, road traffic accident, most often associated with the pelvic fracture. The urine get extravasated in the perivesical space within the pelvis. They can ask you, in membranous urethral injury, the extravasation of urine happens where? The extravasation of urine happens in the perivesical space within the pelvis. Now, I can ask you, in bulbar urethral injury, in the bulbar urethral injury, where the extravasation of urine can happen. So I said, membranous urethral injury, extravasation of urine can happen within the pelvis in the perivesical space. In the perivesical space. In case of bulbar urethral injury, extravasation of urine will go to superficial perineal pouch. Now, penile urethral injury depends on whether the Buck's fascia is breached or intact. If the Buck's fascia is intact and the urine or the hematoma will collected within the shaft of the penis, and if it is breached, it will also can reach superficial perineal pouch. So this is the summary of to know about extravasation of urine or blood stain. Okay, very, very important. So this is the classical presentation. Membranous urethral injury associated with road traffic accident, associated pelvic fracture, intra-abdominal injury, and bladder rupture can be associated with membranous urethral injury. Bulbar urethral injury is man falling astride, man falling on a manhole. All these are typical history of bulbar urethral injury. And for penile urethral injury, it is about the unnatural sexual intercourse, bestiality with animal, and penile fracture. Exact terminology is penile fracture. Penile fracture. Understood? So this is about the history of urethral injury. The most common site is bulbar urethra. Correct? Bulbar urethra. And the presentations I have told you, and I have told you the management also. The patient comes, avoid urethral catheterization, go for suprapubic cystostomy, and wait for 14 days. After 14 days, do a descending cystourethrogram and see for the pattern. See if it is pattern, no extravasation, discharge the patient. If it is pattern, no extravasation, discharge the patient. In case there is extravasation of urine, you plan for surgery and urethroplasty, and timing for urethroplasty and surgery are given you for penile urethra. You should do immediately because it will be associated blood hematoma in the penis, and bulbar urethral injury you have to wait for 6 weeks, and membranous urethral injury can wait for 4 months. Understood? Is it very clear? Yes. Now, having discussed extensively, let us see what Schwartz 11th edition is the latest edition of Schwartz, and page number 1766. Because all the questions in entrance examination are taken from standard textbooks. Okay, so let us see what is given in 1766 in Schwartz textbook of surgery. Common mechanism of trauma urethra includes pelvic fracture, associated injuries, and straddle injuries. Pelvic fracture associated injuries are at the level of membranous urethra. Do you remember the pelvic fracture? I said pelvic fracture mean whatever we say and evolve or from the textbook, standard textbooks, word to word. And whereas a straddle injury, see that straddle injury, see that I said it is bulbar urethra, correct? And the clinical hallmark of urethral injury is blood at urethral meatus. A retrograde uretherogram should be done when the clinical sign is present to diagnose an injury prior to an attempted Foley's catheter placement. The initial step of management, this is very, very important. This is very, very important. The initial step of management is of urethral injury is to drainage the bladder and to prevent urinoma formation and the subsequent abscess formation. In general, this is accomplished through placement of suprapubic tube. After stabilization, see that after stabilization, some centers perform primary urethral alignment. Primary urethral alignment. So very, very clearly said, the initial step, see this very clearly, the initial step in the management of urethral injury is to drain the urine and prevent urinoma formation and subsequent abscess formation. In general, this is accomplished through placement of SP tube, and after stabilization, some centers perform primary urethral alignment. So primary urethral alignment we'll discuss further in upcoming classes. Thank you very much, and join us for every session every day evening, and you will learn important concepts and important stuffs in surgery, and I'll be teaching you surgery. Thank you very much, and have a wonderful day. Bye-bye.
Best training, peaceful environment, PG medical entrance exam preparation were my expectations. I got them at Speed Medical Village in Kanchipuram. Today, I am a PG topper.
Speed Medical Village, a unique eco-friendly campus dedicated for PG preparation. Speed Medical Institute, a complete solution for medical education.